Welcome to the Ergo2go podcast, everybody. This is brought to you by the Back School and Ability on Demand. I'm your host, Matt Jeffs. We bring you interesting people from the world of ergonomics, on-site injury prevention, health, safety, well-being, and a whole lot more. Don't forget to subscribe below and click on the little bell in the upper right-hand corner to get the latest on the fields of ergonomics, health and safety, risk management, human resources, and healthcare, right here on the Ergo2go podcast. Today's guest on the Ergo2go podcast is Director of Education at the Back School, Dr. Bob Niklewicz. Dr. Bob has lectured and consulted in ergonomics since the early 1990s. Bob, welcome to the Ergo2go podcast.
Thank you, Matt. Good to see you.
It's good to have you here today, and it's been something I've been looking forward to for some time. Now, as I may have explained to you, we usually do this sort of thing in a past, present, future format, so it's important maybe for our listeners to understand a little bit about you and your background and where you've come from. I understand you've been a professor at UC San Francisco in their Masters of Physical Therapy program, as well as you also teach ethics in the DPT programs at UC San Fran, but I'm sure there's more history besides that. Can you give us a little backstory?
Backstory? Sure. I think it's the best way to start is my early professional career is actually as a physician's assistant in orthopedics. I was one of the early classes that were graduated back in their 70s, late 60s, early 70s, where they didn't know what to do with a physician's assistant. So I worked in surgery, did orthopedics, cast, tractions, bedside stuff, and I quickly found out that the surgery was exciting for a while, but everybody was unconscious. So I'm a people kind of person. I enjoyed the people afterwards. I was sending them to physical therapy. They come back happier, doing better. I said, that looks a lot more fun than I'm doing. So I went back to school and got my PT degree after that.
Right. And how did you enjoy the PT for a while before you started to move upwards in the ranks, so to speak?
I got the best job in the world. I love being a PT. I still do it. I still have my license. I was in private, after working in acute care for many years in San Francisco, became private practice in Sonoma County. Did that for 27 years. And when it got to a point where I was pushing more paper than patients, I decided to leave that too, went back to patient care at hospital base. But simultaneously, I've been doing ergonomics since about 1990 for large companies, 5,000 employees or so, government entities. And it was just fun. Like Confucius once said, if you find a job that you love, you never work a day in your life. And I've been blessed that way.
You mentioned the bringing ergonomics into the physical therapy realm as a pioneer in blending the two. Where did you see the links between one another?
Well, I think I can really thank the occupational nurses at Hewlett Packard, State Farm Insurance, optical coating laboratories, where they would be sending me patients getting recovery after doing rehab and seeing them a couple of months later with the same problems. And they finally sat down and said, what can we do to improve this? Is we should be on site and looking for prevention, because that's what BT is all about, is rehab, and then hopefully educating them enough to do prevention. So they brought me on board. I basically lectured to 5,000 employees or one company over the course of the year, getting them up to speed on ergonomics. And that kind of was the springboard from that contact. They were talking to other OC nurses who said, how are you getting your numbers better? Well, we got Bob over here. And before you know it, it was word of mouth. I mean, it was strictly a serendipity type of thing where I was right place at the right time, but they appreciated what we were doing as medical professionals, and the rehab and prevention part was where they wanted to put their efforts. I'll tell you a quick story. When we started doing the ergonomic training for the large company, the nurse came to me after about 2 months. She says, what in the heck did you tell these people? I said, what do you mean? She says, I got people lined up outside my door with complaints about carpal tunnel, neck injuries, shoulder problems, and they're inundating us with these complaints. And my career just flashed before my eyes. I'll never work again my career anywhere. And she says, no, we'll stick it out with you if you tell me what you're doing. Well, I was doing what OSHA says. You teach a person about what are the symptoms, what are the risk factors, how do you get yourself in this problem, and prevention and early reporting was crucial. So what they do, they started reporting it. So long story short, we had a big bolus of people coming in with early reporting. At the end of the year, the cost per case dropped dramatically because we're seeing them earlier. And that's kind of where the catalyst was. And I took that product and said, this is what we did here. We can do similar numbers for you there.
That's fascinating. This is the full spectrum of services. We've often found out, as we learn in physical therapy, as you say, it can be very rewarding clinically, but sometimes we feel like we're positioned on the wrong end of the spectrum. When you get to use your skill set on the prevention end, that's got to be very gratifying, isn't it?
Oh, absolutely. You mentioned kind of briefly earlier, we were talking about you talk yourself out of a job.
Right.
Well, we were on site at 5 different facilities in the county. We had 5 employees, 15 therapists running around doing rehab. And as those numbers go down, they say, no, we really don't need you on site anymore.
Yeah.
Okay, well, so be it. But
Yeah.
again, you make lemonade out of things like that.
Right.
That allowed me to go back to school, get exercise masters, my doctorate, so forth, because I was able to now take this idea and expand that into other fields.
Fantastic. You've also worked with some government entities. You mentioned I think I saw somewhere listed the U.S. Coast Guard. What kind of work did you do with them?
That was one of our clients when I was in the private practice. One of my top therapists, she was in the area where the clinic or the station was, and we did initially on-site physical therapy, but the same thing. Why are they getting hurt? Let's go look into the machinery. Let's go into the transport. And she was a top-notch therapist before she retired, but she was a catalyst for them. And so we came in, did lectures on prevention. What are the risk factors? Government entities are a little different than private because the rules are different and contracts are different, but the injuries are the same.
Yeah.
And they only have a limited amount of workforce that are specialists, and if they get hurt, they have to work hurt.
Right.
So there you go. There's some way to keep them on the force and doing a job that they're trained to do because we're doing our job for them.
There seems to be a thread you followed throughout your career and your training, both, as you mentioned, early on as an orthopedic physician's assistant, then into a physical therapy degree, I assume was a bachelor's back in the day like mine was, and then a master's degree in exercise physiology, finally culminating with a doctorate in health sciences. What's the, if I can ask you, the process that led from one to another? Is there a way to verbalize that?
Sure, there is no connection.
Random, just random.
Yeah, to tie the string together, as a PA, my residency was at Letterman Military Hospital in San Francisco, Presidio during Vietnam War. My job there was wrapping stumps, cleaning wounds, and ambulating people on prosthesis.
Right.
Days, if not even weeks, but days after I've been blown up. I have them in parallel bars, and that gave me some insight to what's going on with the musculoskeletal system when it's missing parts or if parts don't work correctly.
Mm-hmm.
So when I got the PA program and then started looking for a PT, that gave me a foot into the PT program because now I have a background in orthopedics, and amputees and wound care was something we were basic PTs were doing. So
Right.
I got into PT school, got into a hospital where, what did I do? Amputees, gait training, and strengthening with younger men. And that led me into an orthopedic background that took me into my private practice.
Right.
In private practice now we have different types of injuries that parlayed into neck and shoulders. I was getting more upper back, neck injuries, whiplash, and I was fascinated by the face and neck. So that took me into TMJ, and my doctoral studies were on bruxism, from all things,
Yeah.
and dentistry. So I did a residency in the UC San Francisco Dental School for 3 years, where I developed a device for anti-bruxing. which gave me more interest in neck injuries, because when you're doing that, you do the whole upper body as far as care. I met a wonderful therapist named Peter Edgelow, who just recently passed, who was doing thoracic outlet. That tied in with TMJ, also upper back. And again, it just spun. Wherever that door opened, I walked through it. Sometimes I stubbed my toe on the threshold. Sometimes I got the thing slammed in my face. But nonetheless, it was that ooh factor. Ooh, that is so cool. What can I do more of this? And that just spun it off. So that's more the curiosity than anything else if you're looking for a thread.
Yeah, it sounds as if, to use that thread analogy, you've connected the dots and recognized larger webs, if I could use that term.
Oh, it was a blast. I mean, I was a physical therapist for minor league baseball teams, soccer teams, physical therapist for high school. My kids were going to high school, cross country, soccer, football. So I'm on the sidelines all the time because I can do this.
That's awesome.
PT allows me to do it.
Yeah. That it sounds like you found the perfect niche for your interest level. Bob, we do this in 3 segments. We're going to take a pause here for a moment. Okay. We want to get into some more of the up-to-date things we're doing now, but we really appreciate it. So do stay tuned. We'll be right back. You've been listening and watching the Ergo2go podcast. I'm your host, Matt Jeffs, brought to you by the Back School and Ability on Demand. We bring you interesting people like Dr. Bob Niklewicz, people from the world of ergonomics, on-site injury prevention, health, safety, well-being, and a whole lot more. Don't forget to subscribe below and click on the little bell in the upper right-hand corner to get the latest info from the overlapping fields of ergonomics, health and safety, risk management, human resources, and healthcare right here on the Ergo2go podcast. Until next time, everybody, be safe, be smart, and be helpful. Let's get to work. Talk to you soon. Bye-bye.